This is Rural Health Leadership Radio.
Hi, everybody. I am your host, Dr. Bill Oxier, and I welcome you to this special episode of Rural Health Leadership Radio. Today's guest is Benedikt Brueckle, the CEO of CompuGroup Medical. Welcome to Rural Health Leadership Radio, Benedikt.
Hello, Bill. Thanks for having me on.
Well, thank you for being here. So, Benedikt, tell us about yourself. Who is Benedikt Brueckle? What's your story?
Sure. So, as you might tell with my accent, I'm from Germany. I was originally born in Munich, in southern Germany, and started about 10 years ago at CompuGroup Medical. I was blessed by the opportunities with CompuGroup Medical in Europe. I lived in Italy and was able to work throughout Europe, from literally Istanbul to Madrid, up all the way to Amsterdam. So it was a very exciting journey. Lately I turned from a city slicker living in downtown Munich into a cowboy. I just moved about 3 years ago from Munich to Apache Junction in Arizona, which is a rural community near Phoenix.
Yes, that's a little different, isn't it?
It is. It's a completely different world. We now see coyotes, mountain lions, wild pigs running around every day. We can enjoy the eggs from our chickens. And I've learned to be very careful outside because there are rattlesnakes, scorpions, which of course are also part of the wildlife here.
Yeah, very interesting. Interesting life journey so far. So why did you choose a career in healthcare, whether it's in Europe or the United States? Why healthcare?
Absolutely. So I've been in touch with healthcare since my early ages. My father, he's a rheumatologist. And so I came in touch with healthcare very early. Unfortunately, we also had some healthcare cases within the family. So I saw the good and the bad about healthcare. And CGM's vision that no one should suffer or even die because medical information is missing at some point is what drives me, and I think our whole team. So I think large parts of the healthcare sector now rely on us, our job, and driving innovation and digitization in healthcare. So that's what drives me, what keeps me up every day. And even after 10 years, I'm still very passionate about that.
Very good. So that explains why you chose a career in healthcare. Why rural healthcare? Because, I mean, Munich is, I've been to Munich. That's a large metropolitan city, no matter how you slice it. Now you live in rural, but you also, you're focused on rural from a healthcare point of view. So why focus on rural healthcare? Why is rural health important to your company, to your organization?
Absolutely. So rural health facilities, whether it's a rural hospital, a clinic, or a practice, serve more than 1 out of 12 Americans, including 1 out of children. Furthermore, a large amount of this population served is living below poverty and or is uninsured. So focus on rural health means, for me, focusing on who needs our support the most. A former president once said, "The values that drive our small towns and rural communities are the same ones that drive America as whole." So I think that's what we enclose in our hearts and vision. And for decades, rural communities have been the backbone of the United States economy. Today, they find themselves falling behind. So I almost see it as a duty to make sure that we bring affordable technology and especially telehealth and telemonitoring into those areas to improve their access to healthcare.
Very good. Thank you. So as you know, Benedikt, the name of this program is Rural Health Leadership Radio, and I emphasize the word leadership. What's your definition of leadership?
Absolutely. So I always say there's no success without failure.
Okay.
So failing, I think, is a substantial ingredient on the pathway to success. In my view, one cannot be a complete manager or leader without experiencing failure and then excelling in finding a way to overcome it, right?
Yes.
So that includes for me leadership, as well as one of the most important points is always leading by example and help your teams to overcome challenges and failure as they occur, right? So it's
Yeah.
very easy to learn from success, but understanding the consequences of why something failed and to have the strength and persistence and the determination to take what went wrong and then turn it into a success is, I think, what requires real leadership and will make and distinguish successful teams from other teams. So
I
that's
love
for me.
I love the fact that you're talking about failure, because most leaders don't want to talk about failure, right? You know,
That is
failure,
correct.
it's
That is
failure.
correct. But
The more you can embrace failure, the better, though.
absolutely. And I think it's same applies maybe to some of the rural communities, right?
Yes.
As I said, for decades, they have been the backbone, then economy changed, but now I think is a chance to take what happened and turn it back into success, right?
Yes. Thank you. I appreciate that perspective. So thank you for sharing that with us. So can you give us an overview of your company, CompuGroup Medical, and the community that you serve?
Yeah, absolutely. So CompuGroup Medical was founded more than 30 years ago in an actual very rural area in Germany, a small town called Koblenz. It was founded by Frank Gotthard, a software engineer, who still today is our global CEO and majority shareholder. Since then, 30 years ago, we have become the market leader for medical software in Europe and have entered successfully other markets, like, for example, the US American market. We employ more than 5,500 employees and are listed at the stock exchange with a market cap of about 4 billion US dollars.
Wow. That's interesting. You know, my ancestors come from a small rural town in Germany back in the 1700s when we immigrated to the United States. So I guess we have something more in common than maybe I thought when we first when we first met and talked about this interview here.
Yeah, it seems like.
Yes. So what about the COVID-19 pandemic? How's that impacted your organization?
Yeah, the COVID-19 pandemic, I think, caught us all a little bit off guard, right?
Yes. Turn the world
Um,
upside down.
Absolutely. So I think our business is tightly connected to the business and work of medical professionals. And the pandemic has forced many doctors, many clinics to temporarily reduce their schedule, close their practice due to the national efforts to save personal protective equipment for hospitals that treat COVID-19 patients and the curtail of elective surgeries and procedures. So that obviously impacted our business and our customers. No questions.
Yes.
For us, my colleagues and I have been working from home the pandemic, but we think that the pandemic also somehow made us stronger. If I look to products like telehealth and telemonitoring, which before the pandemic only played a minor role and were not reimbursed by the payers, we now, during the last 2-3 months, saw that the payers and the Medicaid, Medicare opened up to reimburse more and more from this. And this also created opportunity in these fields.
Yes, absolutely. That's been a big topic of conversation, I know, throughout the pandemic, and the loosening of regulations and all that around telehealth and telemonitoring. So, you know, when a rural health leader is looking at selecting an outside source for telehealth or telemonitoring, what are some of the top considerations, maybe a top 3 list, if you would, of things that they need to look for or consider?
Yeah, that is a good question. And that is actually a big topic I discuss every day with rural health leaders. So I think the main three points to look if you want to go for a telehealth or telemonitoring solution, for example, are number one, obviously affordability, right?
Yes.
There's no reasoning in taking the best solution if it doesn't fit your organization, the budget, and the market you're in.
Okay.
Once this is clarified, the second point you should look at is sustainability. What you can see now, this opportunity has created a lot of very small startup companies, who will try their shot in the medical market, but do not understand the unique requirements of the medical market, as well as unique requirements that go with the HIPAA regulations and so on, which are my third point, security. So you have to look for a company which can give you a solution that has been tested in the market, a company that understands the market, and has a sustainable business so it can support your business for many, many years once you do the investment. And the third point I just mentioned, security, is obviously very, very important, because right now you can read about a lot of data breaches and so on together with COVID, because they use this topic to send you emails, to give you phone calls, to take some information, and then use this information to conduct a data breach in your organization. So I think you need an affordable, sustainable, and secure solution, and then you're on the right track for your telehealth and/or telemonitoring program.
Excellent. Thank you for sharing that. You know, the security part cannot be underemphasized. I mean, I teach a cybersecurity class at the University of Maryland at the graduate school, and we're at the end of our semester, and all the students right now do a project, and it's all about security breaches at hospitals. And it's amazing how those security breaches occur. So good point to emphasize on those top 3 points. So one of the things we try to do here on Rural Health Leadership Radio is share best practices. So what are some of the best practices that you've seen some of the top rural health leaders that you've worked with embrace around telehealth and telemonitoring?
So I think one of the learnings I experienced together with rural health leaders was that I think before COVID, there was kind of the idea that either you do a clinic, practice, hospital, which does on-site service, or you change like 100% to telehealth and telemonitoring. Yeah, I think now in COVID, and now, especially now where we slowly reopen the communities, we see, oh, it goes well together. So I think one of the best practices I see is we can keep the workflow, we can keep telehealth and telemonitoring as an add-on to our patients coming into the clinic, hospital practice, right?
Okay.
For example, there is no need anymore to come in for a quick checkup after a surgery or procedure if they're telehealth. So the patient can stay home, doesn't have to drive in rural areas an hour or two, and can continue to practice social distancing thanks to telehealth. So I think one of the best practices I saw is integrating telehealth and telemonitoring in the pre-COVID workflows, right? And this works very well.
Yeah. Yeah, that's a good point about the social distancing too. If they don't have to come in, and you can take care of things right from their home, right?
Absolutely.
Very good. So can you give us an example of a client or customer of yours that how your service has benefited their organization and their patients?
Yeah, we had a recent example. I don't want to say any names, but it was a community hospital in a rural area, actually here in Arizona, and they experienced, due to COVID-19, an extreme revenue downturn and a decrease in the ability to serve the community because of what you said, the social distancing, right?
Yes.
So patients who should have come into the clinic to get their checkup didn't come because they were afraid of contracting the virus. So what we did is we deployed our telehealth and telemonitoring solution to them. And we saw, especially in the primary care space department of their facility, I would say an incredible effect. We helped them to limit the revenue loss they experienced. We enabled the physicians to continue providing excellent care, and the patient volume went up, and we saw that the worries of the patient of not interacting with the clinic due to the telehealth went down, because now they could practice social distancing and get the care they need. So it was a kind of a win-win situation for everyone. And yeah, this, I think, just shows the power of these tele tools, so to say, in the current times.
Excellent. That's a great story when you're helping people to that degree, because you're right. The hospitals have been losing a lot of money because people don't want to come there, or they can't take care of them for elective surgery, et cetera. So sounds like you made a difference for this particular hospital. We've had a lot of things going on in rural healthcare, not just the pandemic. There's concerns. So from your perspective, what scares you the most about the future of rural health?
That has one simple answer. It's the funding.
Yes.
I have to say. We often see billions. For example, like the first part of the CARES Act money. It goes to larger hospital systems because it was distributed based on the Medicare payments. And the ones who needed it the most, with a large population of either uninsured or Medicaid, didn't get the money. In the past decade, we saw hundreds of rural hospitals closing. And right now we have hundreds, I think it's within the 400s hospitals in rural America who are very vulnerable to closure.
Yes.
And I think if now, especially under COVID, we do not address the short-term cash needs of rural hospitals, we're going to see hundreds of rural hospitals close before this crisis ends.
Yes, that is scary. All right, well, let me flip that question around for you, Benedikt. What excites you the most about the future of rural health?
Yeah, I think that's the opportunity, right? I mean, and I know there are talks now about extra funding and so on, if the politics, right, together with the private economy, as well as the healthcare providers, do it right, I think we can bring back rural America and improve the many, many lives. And that's, I think, what keeps us going. This opportunity keeps me excited and everybody in our company.
Yes, that is exciting. So we've covered a fair amount of topics here in our the quick time that we've been talking to each other, Benedikt. If our listeners only take one thing away from the conversation today, what should that be?
I think the one thing everybody hopefully takes from our conversation today is that we have to support our rural communities, and that telemonitoring as well as telehealth is one of the many opportunities to do so.
Benedikt Brueckle, CEO of CompuGroup Medical, thank you so much for sharing your knowledge and expertise with us here today.
Thanks for having me. It was a pleasure.
If you'd like to connect with Benedikt or his company, you can find their contact information in the notes below this video. And if all else fails, you can just reach out to me and I'll be glad to connect you with Benedikt or someone from his company. If you would like to learn more about the CompuGroup Medical, you can visit their website. It's pretty simple. It's cgm.com. If you'd like to learn more about Rural Health Leadership Radio, hey, guess what? We have a website too, and you can check us out at rhlradio.com, or just use your smartphone. Use the podcast app on your smartphone to search for Rural Health Leadership Radio, and you'll find us there, and we always appreciate if you subscribe. If you enjoyed this special episode of Rural Health Leadership Radio, or you know someone who might benefit from it, please share it with them. We are here to serve you. Until next time, let's keep working to improve rural health, one conversation at a time.